Hi, my name is Pamela Saracini. This is going to be my full head-to-toe assessment for Pensacola State College Bachelor's Program for the Health and Assessment class. This person is Julie. She's going to be my patient today that I'll be doing a head-to-toe assessment on. Julie, do I have your verbal consent in order to do a head-to-toe assessment while video recording it?
You do.
Okay. First, we're going to start off with, I've already washed my hands prior to starting this video, but I'm going to use some hand sanitizer as well to maintain proper hand hygiene. And I'm going to rub the sanitizer in until it's dry. Alright, first thing I'm going to do is I'm going to assess Julie's appearance. Julie is well groomed. She's dressed appropriately for the time of year and for the weather. She has on her hospital gown because she is here in the hospital as a patient. Alright, Julie, do you have any significant health history?
Not really. I have some migraine headaches and I've had my tonsils removed. That's the only surgery I've had. No real medications. Mostly healthy.
Okay. Do you smoke?
I don't.
Did you ever?
No.
Okay. How about family? You got any family history for health problems?
My dad has had a stroke. You just want my parents?
We can do your parents, yeah, your direct relatives.
My sisters have no real health problems. They're all still young. My mom has some heart failure.
Okay. And how about your grandparents? Any diabetes or cancer in the family?
My grandmother had breast cancer and my grandfather died of heart failure.
Okay. So you have some cardiac and cancer in the family. All right. All right. Next thing we're going to do is we're going to assess Julie's height and weight. So if you'll stand up for us, we're going to measure you. And Julie is 60 inches high. We're going to measure her waist in order to calculate her BMI, which is her body mass index. All right, and Julie's waist is 28 inches. Next thing we're going to do is we're going to have Julie step forward onto our digital scale. Julie, if you'll step forward for us. All right, and Julie's 105 pounds. With those numbers calculated, Julie's body mass index is 21. All right, let's have a seat and we're going to assess Julie's vital signs. All right, the first thing we're going to do is we're going to use a manual blood pressure. We're going to do that by using this blood pressure cuff and a stethoscope. And what does your normal blood pressure usually range?
I usually run a little low, usually like 90s over 60s or 50s. Even.
Okay. All right, and Julie's blood pressure in her right arm is 92 over 58. Just for accuracy, we're also going to check her left arm. some good things. She's a nurse's dream. All right, and she's 94/60 in her right, in her left, excuse me. I'm in my left and my right. All right, next thing we're gonna do is we're gonna assess Julie's temperature. This is a Dynamap machine. It does heart rate, blood pressure, pulse. Let me bring it over here so you can see me. This is a protective probe over to keep it clean. You're going to put the thermometer toward the back side of the, underneath the tongue pouch. All right, and her temperature is 98.3. Next thing we're going to do is we're going to check Julie's oxygen saturation and pulse rate by using this, which is an oxygen probe. And I'm also going to assess her radial pulse for a full minute. And Julie's pulse is regular. I'm also assessing her respirations for a full minute as well. Her respirations are even, non-labored. Her pulse is normal, rated as a 2+. Her pulse is 68 beats per minute, and it's showing here at the Dynamap that she's 70, so we're roughly around the same. And her oxygen's at 97%. Her respirations are 17 per minute, and like I said, even, non-labored. Have you ever used oxygen in the past at home?
No.
Any lung problems?
No.
Okay. Next thing we're going to do is we're going to let's discuss pain. Have you had any chronic pain issues?
No.
Are you in any pain right now?
No.
Okay. All right. Next thing we're going to do is we're going to assess Julie's head. First thing we're going to do is we're going to look at the evenness and symmetry of her face. As you notice, her face is even and symmetrical. We're going to then assess the eyes. We would use an ophthalmoscope, which looks like this. We would, with the ophthalmoscope, you would be looking at the ocular, fundus. All right, and we're just going to take a quick look. Okay, and now the other one. Good. All right, what we're going to do now is we're going to have Julie follow my finger with her eyes. Stand aside so you guys can see. All right, up, down, and only use your eyes. Good. Now we're testing her ocular movements. Next thing we're going to do is we're going to look at the eye itself. The sclera is white. The eyes are moist. No drainage. Do you wear any glasses or contacts?
No.
Any eye problems in the past?
No.
Any infectious eye problems such as pink eye?
No, I have had a few pink eyes, yeah.
Okay. Next thing we're going to do is we're going to move on to the, before we move on, I almost forgot. We need to assess Julie's pupils. I'm going to shine a bright light into your eyes. And this is a pen light. All right, and Julie's eyes are equal, round, reactive, and accommodating to light. And I would grade her pupils at probably a 3. Next thing we're going to do is we're going to look at Julie's nose. The first thing we're doing is we're assessing from the outside. We're noticing that the nose is even, symmetrical. Any problems breathing out of your nose?
No.
Okay, and how about runny nose, which would be rhinitis?
No.
Okay. Normally you would use a speculum to examine the inside of the nose. You would examine the nostrils, the nasal turbines. But what we're going to do is we're just going to use a pen light. Good. And Julie's nose is clear, and I'm not noticing any lesions. Next thing we're going to do is we're going to examine her temporal artery, excuse me. Okay. And her pulse is even, normal, and within range. Next thing we're going to do is examine her temporal mandibular joint. If you'll open and close your mouth. Okay, and any problems opening and closing the mouth?
No.
Any lockjaw?
No.
Okay. Next thing we're going to do is we're going to examine her mouth. If you'll say, ah. All right, and Julie's had a past history of a tonsillectomy, so she doesn't have tonsils. All right, can you lift your tongue? Good. All right, Julie's mouth is moist. There's no lesions. Her teeth are in good condition. Next thing we're going to do is we're going to examine her cervical lymph nodes. Any tenderness or swelling?
No.
Okay, and I'm not noting any swelling as I feel. Next thing we're going to do is we're going to examine her ears using an otoscope. We'll be looking at the tympanic membrane and the canal, the inner ear canal. Okay, the membrane is pearly gray. There's no drainage or excessive amounts of cerumen, also known as earwax. We're also assessing the symmetry of the ears as well as the outside to make sure that there's no problems with hearing or lesions. And again, we're examining. Okay, very nice. The next thing we're going to do is we're going to use what would use as a tuning fork to assess Julie's hearing. And what we're going to do is we're going to use a high-pitched tuning fork. You would hit it on the palm of your hand, hold it up to the patient's head, and let me know when you can hear. Okay? And we're going to try the other one as well. Again, hitting it on the palm of your hand and holding it to the patient's head.
Yes.
Okay. Excuse me. Next thing we're going to do is we have a Snellen chart over on the wall. Julie, if you'll cover one eye. All right, and can you read the third line from the top?
E-U-W-Q.
And how about the second line from the bottom?
R-K-E-X-E-X-A-R.
Excellent. And can you do the same with the other eye?
E-U-W-Q.
Okay.
R-K-E-X-E-X-A-R.
Excellent. All right. Next thing we're going to do is we're going to listen to Julie's heart and lungs while she's sitting up. First thing I'm going to do is I'm going to listen to her lungs from the front and then from the back. Now I'm going to be listening to her lungs from the back, and her lungs sound clear and even. No adventitious breath sounds noted. Now, traditionally, this would be done under the gown and on the bare skin, but for Julie's privacy for the video, we're going to do it above the gown. Next thing I'm going to do is I'm going to listen to Julie's heart sounds, and I'm going to articulate them in a Z-shaped pattern. All right, any heart problems in the past?
No.
All right, and how about lung problems?
No.
Any breathing problems?
No.
Okay. Julie's heart sounds are clear, they're normal sounds, she's got no murmurs, her heart sounds are even. All right, the next thing we're gonna do is we're just gonna assess Julie's skin. The skin color and temperature is even. She's warm, the skin is dry, it's intact, there's no rashes or lesions noted, hair growth is appropriate. We're also going to assess Julie's head as well. What we're doing is we're feeling for just bumps or rashes or any problems with your scalp that you've had in the past.
Just dandruff.
Okay. Any falls?
No.
Okay. The hair, if you notice, her hair is shiny. It's clean, it's appropriate. All right, next thing we're going to do is we're going to assess your reflexes. Normally you would use a reflex hammer, but since we don't have one, we're just going to use a marker. All right, what you would do is you would hit the reflex hammer on each knee evenly and look for the jerk of the foot, okay, and both of Julie's reflexes are equal and intact. Then we're going to check your arms. Can you stick both arms out in front of your face and close your eyes? In this, we're assessing for drift. And as you see, Julie's arms maintain in front of her and they maintain in the same spot. You can open your eyes again. All right, we're going to check for flexion and extension. Can you bend your arms towards you and pull them out? Good. Now we're going to check for her circumference of her circular movement of her arms. Can you take your arm and put it in a big circle? All right, and how about the other one? All right. Any rotor cuff or shoulder injuries or issues in the past?
No.
How about any musculoskeletal issues?
No.
Okay. Now we're going to do the second part of our exam lying down. So if you can, we're going to have Julie move to the bed and we'll continue with the exam. Now that Julie's lying down, we're going to continue with the second portion of our examination. First things first is we're examining for her jugular venous pulse. All right. And that looks even, normal, it's not bounding. It is visible, but it is not bounding. Next thing we're going to do is we're going to check for her trachea. The trachea is smooth and midline. Next thing we're going to do is we're going to palpate her thyroid. And what we're palpating for is nodules or pain. Any pain or tenderness here?
No.
Okay. Next thing we're going to do is we're going to assess Julie's carotids. We're going to do them one at a time. I don't want to pass it out on us. All right. And those are also within, they're normal, they're rated a 2+, they're even, they're equal. Next thing I'm going to do is I'm going to listen to Julie's heart sounds again and lungs while she lies down. Any problems breathing while you're lying flat?
No.
And again, I'm articulating her heart sounds in a Z-shaped pattern. I'm doing that because it gives you the best, you're able to listen best to all the vowels. Her heart sounds are normal, there's no murmurs, there's no irregularities. And I'm listening to her lungs while lying down, and I'm listening for crackles or any kind of wetness, wet sounds, any rubs, which she does not have. Next thing I'm going to do is I'm going to listen to all 4 quadrants of Julie's abdomen to articulate for vowel sounds. And Julie has vowel sounds present in all 4 quadrants. However, if we didn't hear one, we can listen up to 5 minutes in each quadrant. Next thing I'm going to do is I'm going to palpate her abdomen. Any pain or tenderness when I do this?
No.
All right. Next thing we're going to do is we're going to percuss Julie's abdomen. And what we're listening for is dull or sounds, and the dull sounds are where the organs would be. The hollow sounds that you would hear are usually over pockets of gas within the abdomen. Sorry. And this dull sound over here is sounding at the beginning of the liver, so next thing we're going to do is we're going to palpate the liver. And what we're feeling for is a smooth, rounded edge, no irregularities or pain or hepatomegaly. Next thing we're going to do is we're going to palpate Julie's spleen. We're going to start from the lower right quadrant of the abdomen and move over. Okay, and what we're feeling for, again, is smooth, rounded edges. Next thing we're going to do is we're going to palpate Julie's kidneys. We're going to start with this one on the left. And you would reach around toward the back. And again, what you're feeling for is those smooth, rounded edges. Now we're going to do the right. And the left one is harder to find than the right one. All right. Let's talk about monthly breast examinations. Do you do self-breast examinations monthly?
I do.
And where do you do them?
In the shower.
Okay. And how often do you do them? Or what time of the month do you do them?
Just after my period.
Okay, so you wait a couple days and then you do them.
Yeah.
All right, and that's really important, especially with you having a family history of breast cancer.
Right.
All right. What we're going to do is we're going to have you raise one of your arms. So we're going to do your axillary lymph. Any pain or tenderness or swelling?
No.
Okay, and I'm noticing no swelling or tenderness. All right, and let's do the other one to make it even. Let's talk about bowel movements for a little bit. Have you had any problems with bowel movements in the past?
Not that I can remember, no.
Okay. How about constipation? Any constipation problems?
No, I'm usually pretty regular.
Okay. And how often do you go?
Once a day, usually in the morning.
Okay. Any dark or tarry stools?
No.
How about any bright red blood when you go?
No.
Problems with hemorrhoids?
No.
Okay. How about urination? Do you stay hydrated? Do you drink enough water?
Not really.
Okay.
But, yeah.
Okay. What color is your urine usually?
It's usually a little dark.
So you're definitely dehydrating yourself. Any burning or itching when you urinate or pain?
No.
Any issues with urinating? You know, you feel like you're unable to completely empty your bladder?
No.
Okay. Next thing we're going to do is, and while we're doing this, we're also assessing Julie's skin. Again, we're assessing the temperature, the warmth. Her skin tone is even. Again, the hair growth is appropriate. Its color is acceptable. The capillary refill on her fingers is less than 3 seconds. All right. Next thing we're doing is we're going to move down to the femoral pulse. We're also doing her inguinal lymph nodes, excuse me. So first we're going to assess the femoral pulse, which is normal, within range. Now we're going to do her lymph nodes. Any swelling or tenderness?
No.
Okay. All right. Now in this portion of the exam, we're not going to do a breast or genital examination. Have you noticed any changes or problems with your breast?
No.
Any skin changes?
No.
Unusual discharge?
No.
Okay. And how about genitals? Any problems?
No.
Okay. Next thing we're going to do is we're going to do a popliteal pulse, which will be behind her knee. And we're going to assess both of them at the same time to do a comparison. And both of her pulses are equal, they're even, they'd be rated normal as a 2+. Next thing we're going to do is we're going to assess her dorsalis pedis pulse. Okay, and again, we're assessing them at the same time, so comparison, again, her pulses would be rated as a 2+. I'm also noticing in her legs that she's got no edema, no swelling. Any problems with swelling in your lower extremities?
No.
Okay. Next thing we're going to do is we're going to test her lower extremity strength. Julie, can you pull your feet towards your face? Good. And can you push down on me real hard like you're driving a car? Very good. Next thing we're going to do is we're going to assess her ability, we're going to continue to assess strength. Can you lift up both your legs and push down on me real hard? Good. All right, and now we're going to do the right one. Can you help lift up the right? All right, and can you bring it down and press down on me? Good. And we're going to do the left and press down. Okay. We're also assessing the fact that her feet are warm. Her toenails are, we're going to assess her toenails. Take your sock off. And her toenails are, her nail beds are pink. Again, she's well groomed. Her toenails are trimmed. No nail fungus is noted. I'm going to go ahead and squeeze her toe and her capillary refill. I'm also noticing that she doesn't have dry skin or any problems between the toes. Any history of foot fungus?
No.
Okay. How about nail fungus?
No.
Put your sock back on for you. All right. Let's see. Oh, let's test your grips. We're going to test Julie's grips. Sorry, we almost forgot those. If you're going to squeeze my fingers real tight with both your hands, good. And what we're testing here is that her grips are equal. She's equally strong on both arms. No weakness is noted, which is usually a sign of a neurological problem. All right. And I do believe that concludes our assessment.